And now to the program. I have the distinct pleasure of introducing all of our speakers today. We'll be starting with Jerry and Dotty Fickle, Willie Griffin, Kayla Pfab, Nicole Pelletier, moderated by Michael Medwar, speaking on TPN perspectives through the ages. We'll next go to preserving vascular access with Dr. Mark DeLegge. Then we'll follow with emergency preparedness for individuals requiring TPN with Catherine Goodou. And then we will have our Coram sponsor coordinated session and close out the meeting with Dr. Cook speaking on gastroparesis and pain. If you'd like to read more about our speakers, please check out their full bios in our program and on our website. And without further ado, I will turn the meeting over to Michael Medwar to get us started with TPN perspectives through the ages.
Thank you, Andrea. So if everyone here watching who's a TPN consumer or caregiver, you know that whether it's TPN, enteral feeds, or both, and no matter what age you are, you have a story and a unique perspective on what likely has been an emotional medical journey. And today we brought together some amazing Coram consumers and caregivers representing a range of ages, and they've agreed to share some of their own valuable perspectives on their medical journey, living on TPN, and what they've learned. So we're going to, I'm honored to be moderating this panel. We're going to start with Jerry and Dotty. Jerry, you were in high school when you discovered you had Crohn's, and after many surgeries, you ended up with short bowel. You are really part of a fairly small but prestigious club of consumers who have lived on TPN for 40 years. It's amazing. And I think we're very proud of you for achieving 40 years on TPN. I think the obvious question to start off is, how have you done it? And looking back, what have been the keys for you to reach this milestone? I think you guys are still on mute, by the way. That's okay. It was gonna, I was bound to happen. There you are.
Okay.
Yes, thank you.
Yes. Okay, well, I started on TPN on June 28th, 1981. The first 4+ years I had to mix my own because Coram and all these companies were not around. And since then, I have been with Coram for all of my TPN needs. In the early days, I had a lot of support from my family and especially my mother. And we didn't really know it was Crohn's in the early time, but we found that out later. And so the magic drug in the 1960s for Crohn's was prednisone, which I took large doses for many years, and that didn't do much for Crohn's, but it made you feel good. But everything's been pretty stable for a number of years now. And so we've managed, it's just part of your life every day, and you don't really think much about it after this many years.
How long did that take, Jerry? How long did it take for you to get to that point where it just became part of your daily life?
Well, in the early years, why I had the big question was insurance starting out, whether you knew it would pay for it in the hospital, but you didn't know at home. And once we got that straightened out, why my doctor at that time let me, he didn't know a whole lot more about it than I did. And so he let me experiment with how much I needed and whether I was on 7 nights a week or 6 nights or 5 nights. And so for many years, why we did that, and it worked out very well. And so that helped whenever we wanted to be out or travel or something, why we could work around when I wanted to take a night off or something like that.
Right. Well, it's really is an inspiration that you've made it 40 years on TPN, and that you've weaved it into your life so seamlessly to this point. Dotty, I'll pose a question to you. You guys have been married for 53 years, which is a wonderful milestone for anyone. Can you please tell us what it's like being a caregiver, and some challenges or just lessons that you've learned over the years?
Well, with Jerry starting this back in the 80s, of course, he was not like Nicole, who has a young child that she has to probably help. Jerry really didn't need my help. He was an adult and could manage by himself, but I was there for support, of course, anytime he needed anything. And I'm sure when he was mixing his own stuff in the bathroom back when we first started, I was there trying to hand him stuff or make sure things were right. But basically, he's been able to do it. And, I just support him, and we carry on together and do it.
It's a wonderful partnership.
Yeah.
So excellent. So I'm going to go on to Willie and Colleen. Welcome. Willie, I want to mention part of your bio for people who haven't seen it online. You have some amazing accomplishments in your 62 years. You started training in martial arts in 1964 in Goshi Shun Karate. Did I pronounce that right?
Yes.
Okay. And you became a world champion, highly honored in that arena and for teaching self-defense. And you were an employee of Black Entertainment Television and did exercise and fitness segments for the show Teen Summit. And your journey is one that many people in this community can relate to, in that your life was going along very well. And you had a sudden life-threatening event with an intestinal blockage in 2019, and very quickly your life changed and TPN became a daily part of your life. Can you please give everyone some perspective on the difficulty of that journey? And I know it's evolving for you, but lessons that you've learned so far regarding living on TPN and how you've tried to cope.
Yes. So back in 2019, I got up one Thursday morning and I told my wife that I was feeling kind of nauseous. And she said, well, when you get back home, because I had to take her to work, she said, just take some Pepto-Bismol or something to relax. I got back home and, I made breakfast. I got a bucket actually out of the bathroom and set it beside me because I just felt like, I was going to need it. And I was watching the news, finished eating breakfast, and all of a sudden it felt like someone stabbed me in the stomach with a big knife and started twisting. And I began to regurgitate and couldn't stop. And when I finally did, I called my wife and told her what was going on, and I was calling 911. And she said, okay, and I'll, find out what hospital. So they took me to the hospital. I'm not going to mention the hospital, but they took me to the hospital and they, started trying to treat me and everything. And for almost 3 days, they had me lying there in pain. And they gave me morphine and oxycodone. I'd never taken drugs a day in my life as an athlete. And finally, they sent me for an MRI, almost 3 days later. And the next thing I know, they came rushing in my room after that and said, we have to perform emergency life-saving surgery on you. And I'm drugged up, drowsy. I don't know what's going on. And when I woke up in the ICU, I had this ostomy bag on, didn't know what it was. And later on down the line, after spending almost 30 days in there, they discharged me. And I lasted 6 days before I blacked out, and my wife had to call, 911 again, and they had to take me back. And that's been ongoing, back and forth. And they started me on TPN, I think it was.
Yeah, then they realized he was into chronic dehydration.
Right.
Mhm.
And that my body couldn't hydrate itself, and whole nutrition. So the doctors talked to me about, and me and my wife about TPN, and they started me on that. And thank God for about a year and something now.
Two years.
Almost 2 years
Oh,
now.
yep.
I've been on TPN and haven't had any blackouts or anything. And I'm just, trying to hold up and deal with it the best that I can. And so far it's, it's been working. And my wife has been there every day. We've been married for 6 years now, and she's my rock. And she hooks me up every night. And at
It's
8:45, and then disconnect at 8:45 in the morning. Then I go
Yeah.
about my day. Yep.
Thank you
So-
for sharing that, Willie. I know it's been a really difficult journey for you. Colleen, what have you learned from all this? Or are there any lessons that for caregivers that you can talk about?
First of all, it was very hard for me doing a nurse's job because we were never
Train.
given any sort of
I think it was a crash
information of what to do when we get home. We asked, and they were like, "Oh, don't worry about it." And when the nurse come home, she will just give you the instructions, and still there was nothing. So a lot of it, I had to call and get instructions from someone over the phone. So I was very nervous. I was angry
Yeah.
because any slip up or any infection, it was going to be my fault.
You felt that
The-
way.
all
Yeah.
fingers would be pointed. Yeah, I felt that way. So it was a long process of learning and understanding what I was doing. I had to be very careful. I had to sterilize. And then again, we still learning the way that his body is now functioning.
'cause it's cheap, hog.
And there's a lot of changes now that's going on. And I now know that with the TPN and when I'm priming the line, the air bubbles, I have to take my time, learn for those air bubbles to come out. All the
Yes.
different things we have to learn, that there's no bleeding. I mean, there's still so much. I'm still nervous about a lot of it. I still have a lot of questions to ask because you have been on the TPN for so many years. I have questions. Does the TPN packaging get smaller to travel with? Because we want to travel.
Right. Oh, I think we lost you guys for a second there with you're on mute, but I do want to get to Kayla. Time is flying too, Kayla and Nicole, but you guys point out a really
Yes.
Right.
Yeah.
something really important, and that's a lot of people on this therapy. It's a steep learning curve, and you're not feeling well, and maybe your life has changed like that, and it's a lot of pressure to learn very quickly.
It
Yeah.
is.
And I think that's something,
Right.
everyone can relate to. Kayla, you are 28 years old, president and founder of Transplant Unwrapped. And your medical journey is a little different. When you were 11, you had an accident that changed your life, and you were placed on TPN in 2015, and you've had 2 intestinal transplants to try to wean off TPN. I'm going to ask you 2 questions because the way things are going, I don't know if we're going to get back to you. Can you please tell everyone your perspective on what you've been through, what it's like to live on home TPN as a young adult, and also tell us about Transplant Unwrapped and why you started that group?
So, as Michael said, I have been on TPN since 2015. At the very beginning, I was kind of it was kind of, I felt like it was like a setback because I'd been drinking a bunch of Ensure to try and stay away from the TPN and the tube feeds as much as possible. And so getting put on TPN, I was kind of frustrated about it. But I'm somebody that thinks, you know, you should always, no matter if you're sick or not, you should live your life to the fullest every day. So I kind of, you know, just started thinking of TPN as just, you know, another medication that I had to take, and that I would just need to work my life around it. So, you know, we loved to travel. So we, you know, took a 3-week vacation to Australia, New Zealand, because we were able to get TPN that was in the kind of pre-packaged form. We had 3 50-pound suitcases of medical supplies, but we went. Just, you know, being a young adult, going with TPN and stuff, there's obviously a lot of questions from people. And since the reason why I'm on it, you know, my gut, I have chronic intestinal pseudo-obstruction, and it's very much of, you know, like a lot of these kind of invisible illnesses, people don't really know that you have them, can make it difficult in explaining it to a lot of people, especially kind of the younger community. So when I was started on TPN, and that was when I started to get quite sick, you know, obviously a lot of friends kind of just dropped off. You know, luckily I have a couple that are very loyal, but since 2015, I've been in the hospital a long time, most of it. And I've never really had the ability to wean off the TPN. So the goal of my transplants was to wean off TPN. But unfortunately, I had chronic rejection both times. So currently I'm back on TPN as well with the shortcut. But with all of that, there wasn't that much information out there in one place on like intestinal failure and intestinal rehabilitation and intestinal transplant. And so because of that, about a year ago, I started a nonprofit. As Michael said, it's Transplant Unwrapped. And we have a website that's full of educational materials, everything you want to know about intestinal transplant. We have a section on, you know, TPN and enteral nutrition. And we also have a separate site just for kids with a bunch of animations that explain all of these things. So we have an animation about TPN for kids to watch. We have another series on enteral nutrition. So we have all the educational materials, and then every month we hold webinars. So different topics by experts in the field, just like one of these, and virtual support groups. And, you know, I discovered Oley when I first started with TPN, and saw, you know, how great it is to be able to connect with other people. And so, you know, we've really brought that to Transplant Unwrapped too, with different patient stories and different initiatives, like ambassador program where you can talk one-on-one with people. So, yeah.
So thank you, Kayla. And I would encourage anyone who has had a small bowel transplant or is considering it to go to Kayla's website. She has assembled an amazing group of experts for the information on that site. I've attended some of the webinars that are great. So please check out Kayla's group. Thank you. And I want to get to Nicole. Nicole, you're on the panel here representing the parents in the Oley community. And I'm just going to read directly from the bio you wrote, in which you said you are the proud mother of a wonderful little preschooler who is kind, curious, smart, talkative, sassy, and also TPN dependent. And I know a lot of parents in our audience will be able to relate to that description, and also what you and your husband have been through with her, as shortly after birth, your daughter needed surgical intervention and resulted in short bowel syndrome. So can you please talk about your perspective, what it's been like to go through this journey, and how you've learned to manage your daughter's TPN and other daily needs over the last couple of years?
Yeah, so my daughter was born with Hirschsprung's disease. We were not aware prior to birth that that was the case. That's something that's diagnosed after. And so it was kind of an absolute whirlwind for us because we were first-time parents. She's our first child, and that's how we became mom and dad. Was we, the first permission slip I signed as a mom was to put my baby in a helicopter to fly her to the children's hospital without me. So that was like a weird experience. We learned it was a lot. I'm sure, as a lot of folks have spoken about, it's a huge steep learning curve when you're not expecting it. There's a lot of medical jargon that you don't understand, learning about the new anatomy, learning about what is TPN. I didn't have any understanding of IV nutrition prior to this experience. So I was really like, what are we talking about? So it was a lot to take in. It was a lot to learn at first. Spent a couple months in the NICU. Our program did do a really wonderful job of teaching us. But I will say that first night home, all I wanted was the nurses back. I wanted them back. I wanted them standing next to me while I did things. It was scary. It was very scary. And others have mentioned too, there's a lot of responsibility that comes with doing the TPN line care. My daughter also has an ostomy and a G tube. And the central line is certainly the most sterile, and it's a lot of technique to adapt to and get used to. And at first, to be quite honest, I was absolutely terrified. I was constantly afraid I was going to make a mistake. I'd have to really breathe through everything and take my time. But she's 3.5, almost 4 now. And I think over the last few years, it's been a lot of learning to trust myself, having to learn that I do know what I'm doing. I can do this. I still am a big person. I reach out a lot to other families. I'm on a lot of online support groups just to ask other families how they handle things or what they do. I find that really helpful to talk to other people. I also think that it's really important to hear for me being a mom, and my child is only 3.5, to hear from other individuals who are on TPN and who have central lines. When older kids or adolescents or adults are able to share with me things that they feel or experience or what things are like, it's helpful because my daughter can't always tell me what she feels and experiences. I think about this woman who mentioned that after changing her sterile dressing, it would get itchy. And so she would just simply wrap an ice pack in a washcloth and put it on her chest. And I didn't know that I could do that to help my child. So that was helpful to hear someone share. So I find that to be a really big experience being a parent, is learning from other people how I can help my child who's going through it. It's not me going through it. I'm walking through the journey with her.
Excellent. Thank you. Thank you for sharing that, Nicole. Jerry and Dotty, quickly, you've been Oley members for a long time. Can you talk about the importance of being part of the Oley community?
Well, when I went to the Oley conference, that was the first time I got to meet a lot of people that were just like me, that were on TPN. We could talk about the problems we were having, and when you think you're having a bad day and then you hear what some of the other people are having, well, you find out, boy, it's been a good day for yourself. And I learned a lot from the other people about how to live with TPN and everything. So it was the first time I'd ever met anybody, or a whole lot of people that were just like me. And so they were good meetings back in those early days. And so it was good.
Absolutely. Well, I think we're going to have to cut this a little short. Looking back now, I wish we had allotted an hour for this panel. So I hope we can do this again at some point and answer more questions. We didn't get to travel, which Willie and Colleen recently went to their daughter's graduation and traveled with TPN for the first time. And Jerry and Dotty have traveled many times with TPN. But I think, Andrea, I think we have to move along.
We do, unfortunately.
Yeah.
But Jerry, Dotty, Kayla, Nicole, Will, Michael, what a fabulous session. And thank you so much for sharing your perspectives and your experiences with all of us. Amazing. It's so nice. So nice to hear from all of you.
Thank you, everyone.
Yes, and with that, we